I chose to be a pharmacist because when I grew up in a very small town called Blackstone, Virginia, there was a lady pharmacist, which at the time was pretty much a novelty. And my mom had a little beauty shop, and across the street was a drugstore, and she said, "Empsy Marshall, you ought to be a pharmacist. You get to wear a white jacket and drink all the Coca-Cola you want and take care of all these people that need all these pills." And that sounded like a pretty good idea for me. And so in the 7th grade, I decided I wanted to be a pharmacist. And from there, that's the way it happened. I kept going. I went to college, I went to MCV, VCU, and now I'm a consultant pharmacist. My job is I'm one of the safety nets that looks at the medications that the residents take every month, and I usually see them in transition from the hospital to a skilled care facility for 14 days or more of physical therapy. And when they come in, frequently there is duplication of medication. I frequently will see they may be on ibuprofen, Motrin on a routine basis, and they may also be on Coumadin, a blood thinner, after their knee replacement. And when I do the chart review, I will pick up on that and make recommendations to the physician and or the patient's family if it's a medication therapy review that perhaps these drugs should not be given together, and if they are, we need to be extra cautious and take certain laboratory tests to confirm that they are appropriate medications. And that's fairly typical. Most every patient that we have admitted, we do a kidney function, see how their kidneys are doing, and that frequently changes the dose of the drugs that they are prescribed when they come to us in the long-term care facilities. And we are available, I am available for patients and family to ask questions when I'm in the facility doing reviews. I am a resource to them at the nursing station. Pharmacists should be recognized as providers because we are the most appropriate healthcare member of the healthcare team to provide a medication review. We know the medications, that's our forte. We know the medications, we know how they work, we know how they're metabolized, and it makes us a very important part of the whole healthcare team with the physician, the nurses, the nurse practitioners, the nurses' aides. We are one of the team members, and we need to have that ability to be recognized and to be supported by our colleagues, as well as provide appropriate health care for the patients. And we also are able to give immunizations, so we can aid in that process too for the healthy care of adults in my field, especially adults as they grow older and age in place.